I'm Laura Troiano. I am a community team lead dietitian, and I also have a quite bespoke GI clinic, and I'm also the prescribing support lead dietitian for our trust. I took an unusual route into dietetics. I did a pharmacology degree before I became a dietitian, so I've always, from the moment I qualified as a dietitian, seen that there's a huge role of drugs and a requirement of having good knowledge of drugs in order to help our patients. And I worked in a very generic community role, seeing pretty much everything. So I really appreciated that. So when the opportunity came up, I thought it was a really good chance to actually formally have a qualification which would allow me to use that knowledge again and actually just support the patients with better care. Because quite often the patients you're seeing involve medication management as well as dietary management. I think because most of us prescribe within areas where we are seen as a specialist, we actually know more about some of these products or medication than actually the GP does. So feedback that I've had from GPs is, go ahead, you know more about this than I do, and we have the time to unpick that situation and often work out what's the best course of action. So yeah, I think we really are in a place to actually be more helpful to the patient and also reduce the time that it takes other prescribers with less experience in these areas to see the patient instead. I'm very, very lucky in my primary care role. I get a good return rate for my CMPs, but taking that away would save time both on my part, but also from a GP practice's perspective. And it would mean that we wouldn't miss any opportunities. Sometimes you're required to see a patient quite urgently. You don't have the time to put that into place. So it would really, really slick the process and mean that we could prescribe more often and without any hurdles. Being able to independently prescribe means that the right person will be writing the prescription for that person at exactly the right time that they need it.